We're taking your calls for Dr. Zorba Paster. 608-270-9933, the number to call. And let's start with John in Madison. Hi, John. What's your question?
Hi, I'm a lifelong resident of Madison, and I heard Dr. Zorba say on public radio that something that I wanted to clarify. He said that diet pills didn't work, and I was in a situation where I was 130 pounds overweight, and just by accident I ran across this medicine weight loss clinic in Janesville, and they have a product called fendimetrazine. They have nurses, doctors, and I lost 10 pounds a month. They give you the right diet. It's a keto-friendly diet, and I could not lose more than 30 pounds on my own with Atkins, and with this I lost 100 pounds, 10 pounds a month, and I've never felt better.
Well,
That's good to hear.
congratulations.
Is that a safe
That was great. The reality is you lost it because you ate fewer calories, and the other reality is diet pills don't work when you look at it scientifically, but they worked for you. And that's the whole thing about science. We look at whole populations and how it'll work, but it may work for somebody individually, and so, you know, that's congratulations. You did a great job, and you clearly worked on it and worked on your eating. You were highly motivated. You lost all that weight. Great news.
Yeah, that's not easy to do.
No.
Not
Congratulations is right. Let's go to Dorinda in Madison. Hi, Dorinda. What's your question?
Hi. I just have a question regarding sweeteners. I'm currently using some monk's fruit, and I just wondered if you had any anything to say about that, using that as a sweetener.
Oh, sure. I don't know anything about monk's fruit. I can tell you things. You know, stevia, of course, is an excellent sweetener. We know about NutraSweet that's been there. Sucralose has also been around for a long time. Sweeteners do not cause cancer. That's always the stuff that you find on the internet that they cause cancer. They don't. But the question is, when you take an artificial sweetener, do you end up eating more calories later on? And that's a great big issue. The rise in diet drinks has paralleled the rise in weight that we have in the country. And so one theory is that we eat the sweetener and that doesn't give us any calories, but we end up getting more desire to eat later on. So, you know, the best thing to drink, water, tea, coffee, without any sweetener at all.
All right. Let's go to Rosemary in New Glarus. Hi, Rosemary. What's your question?
My question is about nightmares. I don't know. I have tried different medical suggestions, and I am labeled with PTSD after family trauma. That was almost 9 years ago, but I now have 2 daughters who are fighting cancer, so it's always something that's upsetting me. And I try, I keep busy and all that, and so far I have a psychologist that's working with me, but nobody has been able to find something for the nightmares, and they're just horrendous.
They can be just awful. I've got some suggestions for you that may work. A medication you may not have tried, gabapentin, is an excellent drug. It's an anti-seizure drug that we use for chronic pain. Sometimes that works well for nightmares, 300 to 600 milligrams an hour before you go to sleep. Antidepressants, certain low-dose antidepressants such as doxepin can also work for nightmares. And then, of course, the other thing is mindfulness meditation that you can learn to do. There are apps to do that. All those can help. You know, these parasomnias, which are called, can be very, very difficult to get rid of. But actually, if you get a good relationship with a physician, try a number of medications together or independently, they can make a big difference. Very tough.
That's great advice.
Yep.
All right, quickly, Rose in Cottage Grove. What's your question?
I've recently had COVID, and I'm wondering how long to wait to get the booster. And also, I'm considering getting the shingles shot, and I wondered if there was a waiting time for that also.
So first of all, you definitely can get the shingle shot and the COVID shot. You don't get it at exactly the same time. I can't tell you how many weeks you have to wait between one shot and the other shot, but your pharmacist, if you're on Medicare Part D, will tell you that, or your doctor or a physician. And the answer is, after you get the shingle shot, I can't remember what the latest FDA recommendations are, if it's 30 days, 60 days, or 90 days. But once again, pharmacist or doctor will tell you the latest up-to-date information. And the answer is yes, you don't want shingles and you don't want COVID.
And shingles is 2 shots.
Right.
Two shots. And they work. 95% of the people who get the shingle shot never get shingles. The GSK shot that's around is dynamite, much better than the older Merck shot, so I highly recommend that you get it. Only 35% of the people in Wisconsin who should have the shingle shot have gotten it, so I'm really pro shingle shot. Get the shot, covered by most insurance.
Okay, we are out of time.
Yeah.
Thank you all for calling in. We will do this again next week.
Zorba, great to see you.
Good to see
All right.
you.